Thank you. So welcome to our what will be brought to you as a weekly webinar about the risk and compliance updates going on. And so today we're going to be going over some new risks that are posed to your office and how we can properly comply with the rules and regulations that are very recently being put out about these topics. Next. So today's topics that we'll be talking about are updates on the third-party trackers, particularly about your medical websites, the rise and influence of artificial intelligence in your office, and information blocking. Enforcement has begun, so now we must detail what are the potential damages and how do we comply with these new rules. Again, this webinar will be on YouTube. If you have any questions, please put them in the chat box and we will get to them at the end. And so now we'll go to the next slide. A quick refresher on what the banning of tracking technologies means is that back in December of 2022, the OCR released a guidance that banned tracking technologies. Tracking technologies are things like Google Maps, Google Analytics, Facebook links, any kind of social media links. And what these were doing were tracking IP addresses of anybody who came to your website. And the government deemed that because they were going to a medical website, potentially seeking medical information, that because they had their IP address, that this was now considered IIHI, or individually identifiable health information. So they assume that we now need to ban these because we are sending patient information to unauthorized third parties. So after this was released in December of 2022, there was major pushback, lawsuits by big organizations like the American Hospital Association wanted to push back against this and say that this was unlawful. 99% of all websites on the internet use Google Analytics. They use them for reasons that are to benefit the practice whose website it is. It is used to make better decisions about what people want, how to get more people to their website, and it's usually used in good faith. However, these companies are using this information for very nefarious purposes, so the government wanted to ban it. After all these complaints, though, the OCR doubled down in March of 2024, tuning some of the definitions to make it more palatable and more understandable, but in reality, it just kind of doubled down and reinforced what they said in 2022. However, just recently, a federal judge in Texas has deemed that the OCR overstepped its authority with this guidance, which made it so that the government is now unable to enforce this. So now we're seeing that a judge has decided that it was an overreach to define that IP addresses on a medical website was now to be considered IIHI, or any kind of identifiable health information. Next. So what does this mean for your website? Well, we can have tracking technologies, however, they are still banned for authenticated web pages. And authenticated web pages simply just means anywhere where you have to log in, whether it's a patient portal, whether it's a payment link, where patients can go and pay for past due balances, or any kind of maybe a doctor login. If you're putting in a username and password, that is an authenticated web page. And so the issue that still arises and that is still banned is that if you click on a link that has and that page where the link is located has a tracking technology on it, and you get brought to the sign-in page and you type in your username and password, as sickening as this may sound, Google now has your username and password to log into that system. In an example of where it's a patient portal, they now have the login to your patient portal and can now use their technology to go in and gather all of your medical information. How awful is this? Now, just because you clicked on a link and logged in, Google can now go in and see all of your patient information, all of your medications, all of the things that are very sensitive, and they now use that information to sell to third-party advertisers and other vendors so that they can profit essentially off of your medical records. And it's a shame that this is even legal, but we got to kind of play with the cards that we're dealt. So it's very important that if we are going to do this, we do this properly. Next slide. So one thing that we need to do is we need to disable trackers on authenticated pages. So we can't have a direct link to the page that has the sign in with tracking technologies on that page. So what that means is that we need to have a separate part of our website, a separate page on the website that has the link, and ensure that that page does not have third-party trackers. Now, if you have it in a banner, it's important to note that that banner is on every single one of your pages. So if you have the link to a tracking technology or a link to a sign-in with tracking technology, if it's on every one of your pages, it's on the banner, so that's a big issue. So we want to disable it on authenticated pages and essentially segregate where the links are, so that they can't be tracked, they can't go onto your login and steal patient data. And really what all of this does is it brings into question a much bigger issue as we integrate more technology into healthcare. Next. So when we look at this from a bird's eye view, we are seeing that technology is being integrated into healthcare to make our lives easier. However, what they do is that they provide security risks. And the government has emphasized that if we're going to implement these new technologies, we must be considering privacy and security. So we talked about website trackers. We're going to be talking about artificial intelligence very soon, and patient portals are the latest technologies coming to healthcare. And with these, their supposed benefits, there are a lot of things that are going to make healthcare better. It's going to make the lives of the doctors and the staff easier in terms of automating workflows. But there is still, again, privacy and security risks along with it. So that is what we're going to be going into more. We went into website trackers and how to properly implement patient portals and authenticated web pages on our website. So now I will be turning it over to Michael, who will be moving into artificial intelligence and how it's being used in your office.
Okay, thank you for that, Joe. And yeah, so what Joe just basically stated is it's very easy to get your web designer to take the tracking technologies off of certain pages. That way you leave them on the rest of your website. So that's a good thing for them to know, Joe. Thank you for that. Okay, so we're going to move into AI, artificial intelligence. It is the hot topic button that's going on, and a lot of practices have already started implementing this, but have they thought of all the considerations? So we want to make sure that we kind of point out some of these things as you go into implementing AI. The advantages are great. Automated documentation saves doctors time. I've heard of doctors saving up to 2 hours per day using AI. Enhanced accuracy. I've heard of, again, doctors who are not known for their good and accurate notes using AI and now being the stars of the practice. And it also can help with patient engagement. But again, we're going to go through some of the things. If you've not implemented AI into your practice yet, you probably will be. And again, what we're doing is basically putting together a customizable set of policies and procedures, going over the things that we talk about today, so that not only have you thought about the implementation, but you've also got it documented, which of course for HIPAA is very, very important. So first of all, most states have a two-party patient consent law. So how are you handling those? The oversight of this clinical documentation, integrating it with your current and existing EMR, and then we're going to kind of basically go over some of the privacy rule and security rule considerations. Again, this is a fast webinar, so we're going to be going through this information quickly, but again, this recording will be available and the slides are also available to you. So in all the AIs that we've reviewed so far, they do record the session. Some of them will almost immediately delete that recording. Some will keep it for longer periods of time. Others, in fact, use it to help train the AI for the future. So, the session is being recorded. And how do you want to get that? So there are two ways to get the consent, at least in the state of Florida. We need to check with every state and see what the law is. But if you have to get consent, are you going to get that at the front desk? Are they going to sign a paper legally? In the state of Florida, a signed paper consent is your best defense in a lawsuit, but it is also permissible to put it on the recording itself and state at the beginning, we're recording this session. Do you permit that, or do you agree with that and allow us to record your voice? Now, who's going to do that? Is it going to be the medical assistant? Because the person that's telling them about this consent is probably going to have to, in many cases, do a little telling the patient what this is about. You're recording me. Why are you recording me? So is that going to be a job for the medical assistant before the doctor gets in? Or are we going to have the physician saying, I'm starting your exam, we're recording it as part of our EMR process, and then have to answer and go through that with the patient as well? And then what are we going to do with those patients that say, I do not want to be recorded? How are we going to handle that in our processes? So oversight of the clinical documentation is another thing that we need to make sure that we do. AI makes mistakes. I have really been using ChatGPT a lot. I like it, but I do understand and see where it does give you incorrect answers or looks up the wrong information and will give you information that doesn't pertain to what you asked about. So our doctors and clinical staff must be trained that they have to monitor and review these recordings or the documentation prepared by the AI. So what types of programs do we have to detect any errors and to correct any mistakes? What I see happening is that there's a good chance that the clinicians will get so used to AI being perfect that they just start signing off on them and then again run into that error. So we're going to have continuous and ongoing training for the clinicians and the staff so that they effectively monitor these AI tools that are going to help them out. What about coding? If we're using it not only to document the patient exam, but also use it for coding, and again, even in documenting it for the exam, we have to make sure that the system doesn't upcode or downcode. So what are we doing in our practice? What is our policy and procedure to make sure, again, that the transcription or the input of the AI is meeting exactly, what that patient needs to be billed for? And if you have a billing company, maybe they're using AI and you don't know about it. So we are updating business associate agreements to make sure that if they are producing or using AI on your patient data, that we have that documented, that's been addressed in a risk analysis, so that is there. The other thing is with AI, again, depending on the vendor that we're using, depending on whether they're storing that information, the recordings, whether they're sharing them, no matter what they're doing, if those recordings are being kept outside the continental United States, you may be running into problems with state law or with state Medicaid law that do not permit the sharing or the storage of PHI outside of the continental United States. So that's, again, part of the risk assessment process, not only for you, but also maybe for your business associates that may be using it. So again, when you talk about AI, AI is always being updated and continuously learning to provide a better output. But you have to know how your vendor is using that to make sure we don't run afoul of HIPAA considerations. Integration challenges, overcoming the challenges, in the exam room. So ensuring that the tool we use is compatible with our EMR. I know a lot of EMRs are already building them in. So of course there you don't have to worry too much about that. But what if you're using a different EMR? How are you going to get the information from that AI into your EMR, into the proper sections, so that you maximize the use of this new AI technology. And then also workflow. So again, if other people are going to be accessing the AI recording for that particular exam, is there an easy way for the medical assistant to start it, explain and get consent from the patient, stop that recording, and then for the provider to come in and pick that up where they started? Or would that be two different sessions and you might get billed twice from the AI company, one for when you got the consent and then the other when they came in? So those are things that you need to know. And again, the AI needs to be checked immediately, because what if something happened, it didn't pick it up, the microphone dropped out? What's our availability to get with technical support to get this corrected, so that we don't have exams that don't get recorded and then we have to call the patient back in or try to remember days later exactly what happened in there. So definitely want to have all of this thought out in a policy and procedure. And again, training is critical on there as well. When it comes to the privacy rule consideration, the heart of HIPAA is the minimum necessary policy. So you're going to be collecting all of this data through the EMR, through this recording, and you're definitely getting more than is minimally necessary to put into the report. So again, how are we going to correct that? How are we going to limit that? So again, probably one of the easiest ways is we do the recording. It gets put in, the recording gets transcribed into the EMR, and then the recording's destroyed. That way we're not undoing it. But again, is that our vendor keeping it? Are we keeping it for maybe 2 weeks just to make sure that everything gets done properly? We may not be able to review the output right away, so it may be a week or two. Are we keeping that? How are we going to apply minimum necessary? How are we controlling access to those recordings? Again, the recordings may have a lot more PHI and sensitive patient information than actually makes it into the chart. And so we want to make sure that the access to those recordings is very controlled, very limited, and that we have a way to audit that. And again, we also really, under the privacy rule, have to make sure that our third-party vendors are making sure that they are, again, complying with HIPAA, not storing this outside of the continental United States if it's not allowed. If it is, we definitely want more security requirements maybe built into our business associate agreement. Are they using it? Are they de-identifying it? All of these things are critically important, because if they have a breach, it's your breach. And so we want to make sure that as AI increases in use, that we know which one of our business associates are using it and how they're doing it, because again, if it's going off-site, being used improperly, that's going to be our problem. So our business associate agreements have to be updated, and we're probably going to want more security information, making sure that they are complying. What I found is, unfortunately, these business associates, they want your business, they'll sign the business associate agreement, but if you ever ask them for third-party verification or even a copy of the risk analysis, they'll ask you, what is a risk analysis? That tells you that they are not HIPAA compliant, and you are putting you and your practice at tremendous risk. So another privacy concern, and this is a big one for the government and for the Office for Civil Rights, is that there is inherent bias in artificial intelligence. It's like anything. When you build something, the person building and coding that software, their biases can get put into that. Where was your AI trained? Again, AI is basically a large language model. It's just taking in lots and lots of data. But was that data in a South Philly hospital? Was it in a New York metropolitan hospital? Or was it in a rural clinic in Kansas? It could have all kind of different results and outcomes and how it's outputting your notes based on how it was trained. So the biggest thing here, again, is training and awareness, making sure that our staff and especially our clinicians are reviewing for any bias that they may see. through the initial assessment of the AI that you're using, the ongoing monitoring, and then how the clinician's going to report any bias that they see. So this is definitely something you want in your policies and procedures, because again, it is a major concern with the government that AI could give different treatment plans based on that patient's information. Even two patients that have similar symptoms, one with a chronic condition may get a separate and different outcome or recommendation for treatment plan than the one that doesn't have the critical condition. Those are the type of things that your offices, your clinicians need to be looking for. Encryption. So the security rule, we want to find out where are they encrypting it. So are these recordings, how protected are they? Are they encrypted at rest? So if somebody were to get into your system, they couldn't access them. Are they encrypted as they go through any transit, whether they're being transferred back to the AI vendor or whatever? We need to know and document in the risk analysis where encryption is being used. Again, those access controls, making sure that only those that can. Here we want to probably be more restrictive with who can and cannot access these recordings. And then audit trails. Can we go in and monitor who accessed them and do a report on that? So again, all very important here that we consider for the HIPAA security rule. So regular audits, it's now a part of our risk analysis. We actually just added this week as we prepare for going into this. So if you've not already had your risk analysis this year, it will be a part of it. If you have had your risk analysis this year, please notify us that you are using AI, and we will go through and update that process. You also, again, need to have a good incident response. You know, how are your clinicians going to report any of this to you and to the staff? Okay, so that's a quick overview. Again, by the end of next week, we will be sending out to all participants and actually all of our clients the policies and procedures that'll be customizable so that you can check this is the way we're doing it, this is the way we're doing it, because every practice will do it a little differently, but we'll give you that. If you've got any ideas, especially once you get them, again, a work in progress. If you see anything that we've missed, please let us know so that we can continuously improve the policies and procedures on this. Now, real quickly, the government has finally, after April 21st of 2021, the information blocking went into effect, but basically nothing's been done because there's been no enforcement. The enforcement rule has been published, and within the next 20 days, it will go into effect. And for medical practices and hospitals, there are appropriate disincentives. These disincentives may not be what we expected. So the goal of information blocking was basically to make sure that there was a more free flow of electronic information between practices, especially for continuity of care. Information blocking is defined as anything that is likely, so a very low standard here, likely to interfere with access, exchange, or use of that electronic protected health information. So, you know, it's a pretty big category. HIPAA permitted you to share records. Information blocking requires you, especially for continuity of care. And the inherently suspect activities that they listed is, again, providers requesting medical records for treatment or continuity of care reasons. So what are the penalties? Well, the penalties are for medical practices that you could lose the performance category in MIPS of promoting interoperability. So you would get a 0 score. That compromises about 25%. So you probably will lose your MIPS money if you are found to be an information blocker. And then, but for the average practice, that's less than $700. So is that going to be a big enough incentive? And dental practices and a lot of other medical practices do not use MIPS. So they're not going to be, there's not going to be any disincentive for them to not be an information blocker whatsoever. If you are a part of an accountable care organization, you could lose being eligible to participate in that for at least 1 year. So in other words, if you didn't send records for continuity of care, or let's say you requested an authorization, even though you knew the provider was a provider for this patient, that is information blocking, and one of these two penalties could apply to you. The other thing, and where this may have the biggest effect, is hospitals. Hospitals could lose 75% of their annual market basket increase if they are an information blocker. So I think the biggest incentive with this is for them to do that, to not be an information blocker. Make it easier for you as a practice to get records from the hospital. I know for most of our practices, that is always, if you don't have access to the portal, that's always a very difficult process. So hopefully this will increase it, but for other medical practices and continuity, especially in dental and other practices that don't participate in MIPS, we may not see any improvement in the sharing of medical records. So we'll see how they do that. The other thing I want to point out here is this is going to be enforced by the Office of the Inspector General, and they're the ones that do Medicare fraud. They just came out with a huge, I think, 200-person action where they stole like $3.4 billion. There was another incident that they just notified where just 2 providers billed Medicare improperly for over $200 million. So are they going to be concerned with going after practices that don't share records with other practices? Not sure that that's going to make it to the top of their list. So we'll see how information goes out. But I do want you to understand the enforcement is in place. We don't want to get caught up in that. So make sure that you review your training on information blocking and that you go over it, especially with your medical records staff. Okay, so again, time to update your training for information blocking, AI in healthcare. And here I'm going to tease our next webinar, Reproductive Health Information. If you've not heard about this, this could be big. So we're going to do a webinar specifically on this on Friday, July 12th. And we've got the information here for you to register. But again, this is going to be a new reproductive health care. The government said it's not a new class or category of protected health information, but it really is. And there are certain new restrictions. There are certain new postings that you're going to have in your business associate agreements. Business associates are covered by this as well. So you may want to send this information to your business associates, as they will be covered for this. And I guarantee you they know nothing about this. It went into effect on June 25th. And again, I've never seen them put out so many alerts on this. We got one on the 25th. We got another one today, encouraging you to make sure that you are implementing this, even though the actual date that you have to be compliant is December 23rd. They are stating you better do this now rather than later, now that it is in effect. So we will have that information for you on this upcoming slide or on this upcoming webinar. So please make sure you attend it, get it to your colleagues, and definitely make sure that your business associates sign up for it, as they are directly related here. We will be updating your business associate agreements for this. We will be updating your notice of privacy practices. That's going to be probably the next webinar after this one, is all the requirements you're going to have. You're going to have a complete new notice of privacy practices by the end of the year. And again, as our clients, we'll be putting that together for you so that you'll have that and have it up in time. So I want to thank everybody. I've got a couple minutes left here, so I do want to see if we've got any questions. And so I do see one question here. Nope, actually just a nice thank you. We appreciate that. Looking in chat, I don't have any questions there. So Joe, anything that you wanted to mention before we, I'll continue to stay on here for a couple of minutes and go on, but anything that you wanted to state as well?
Just that, again, this will be on YouTube under our HIPAA TV YouTube channel. So just go onto YouTube and search up HIPAA TV, and you will find our YouTube channel. Again, if you want to ask any questions, feel free to email the email on the screen so that we can get to you as soon as possible.
Okay, with that, it just came 1 o'clock. So again, we thank you. We want to keep these short so that you can get this information without having to go through a full hour-long webinar. And of course, as always, any questions, any concerns, please send us an email. I have switched emails. If you want my attention quicker, please send it to Michael McCoy at HIPAACK.com. That one, actually, I get alerted on constantly, but again, feel free to give us a call as well. We try to answer all calls the same day or get back to you same day. Email, we get back to you within 24 hours. So thank you again for attending. We look forward to seeing you in the next webinar.
With HITECH Associates, a real person works with your practice to complete your HIPAA documentation. We are not selling a software program. We are your compliance partner. If you are interested in making sure your organization is protected before it is too late, please go to HIPAAComplianceKit.com, linked below, to learn more about our services. We offer a free, no obligation, 30-minute consultation with your practice, and we'll send you a compliance report card based on that call. Thank you for watching. If you learned something, please like the video and share this video with your colleagues. Subscribe today to stay up to date on all things HIPAA.